Hello everyone, my name is Dr. Kenny Compton and today we're going to be talking about human papillomavirus, also known as HPV. So for many years, this virus wasn't talked about frequently. Many people weren't educated or they were misinformed or just not informed at all on HPV and the dangers of HPV. So it's now on to us to become more educated and more informed and hopefully pass on this information so that others could prevent themselves and also manage the virus. And we'll talk about this a bit more. So what is the first thing one should know about HPV? So we should know that HPV is a sexually transmitted infection, usually through the skin or other internal organs such as the cervix. It's a small DNA and there are over 150 types of HPV viruses. We're only going to categorize them and we're going to talk about a few. So the first two categories is ones that affect the mucosa, and the next is the cutaneous, the skin. So the ones that affect the skin are usually affecting the hands and the feet and usually just cause common ones. And then we have the mucosal type, which is further broken down into high risk types and low risk types. So the low risk types, type 6 and type 11, they basically have a lesser chance of becoming cancer. So they usually present with symptoms and signs such as respiratory laryngeal papillomas or low-grade abnormalities in mucosal cells and genital warts, but they usually never evolve into cancer. Then we have the high-risk type, which is type 16 and 18, and those have a higher chance of becoming different types of cancers, such as vaginal cancer, vulvar cancer, cervical cancer. Just usually cancers in that region is usually more frequent with HPV 16 and HPV 18. Then we want to know, how do we get it? How is it transmitted to us? So HPV is usually transmitted directly from human to human contact. The most common way is through sex. So this includes vaginal sex, anal sex, and oral sex. So basically, everyone that's sexually active have a high chance of contracting HPV. Usually, it could include groups such as people with a low immune system or those that engage in anal sex frequently, more frequently than others. It's a disease it's a virus that's easily detected, and usually once a person becomes sexually active, they start becoming screened for pap smears, and usually when that's negative or abnormal, that would indicate to your provider that there's further testing to be done. So then they will go on to collect more samples and then further narrow down the test for HPV DNA and then confirm the diagnosis. So usually in cases, this is how it's detected through an abnormal pap smear and then further screening. And it's just a simple sampling of the swab in the vaginal region. They test in the lab and they confirm whether or not you have HPV. So how can you prevent it? So HPV, like I said, is very common. And one of the most common ways to prevent it is to avoid areas of your body, such as your mouth, your anus, and genitals, from becoming contact with someone with HPV. So this means not having vaginal sex, not having oral sex, not having anal sex. So essentially abstaining. And basically abstinence is one of the most effective or 100% effective way we could prevent yourself from contracting HPV. Another way is the use of condoms. For those that do like to engage in sexual activity every now and then, condoms can serve as a physical barrier to reduce the spread of HPV infection. Usually, a lot of studies conducted show that young women, after initiating sexual activity and with regular use of condom, reduces the transmission rate of HPV between partners. In addition to HPV, vaccination is recommended. So HPV vaccine produces one of the strongest immune response in preteens. It usually works best between ages 11 and 12, and the vaccines are given in a series of shots. So shown here is a breakdown of the age the shot should be given, how many doses, and exactly when, and how long after should the second or third shot be given. Usually, it is recommended by the American Cancer Society for recommendations that HPV vaccination for girls and boys should be started at age 11 and 12. Like I said, it's most effective at that time. And it's also recommended for females between 13 to 26, and for males, usually between 13 to 21. Some males, older males between 22 to 26, can also get vaccinated with a new type of vaccine they have now called Gardasil 9. It's proven to be effective for males greater than 21. And then other simple ways to reduce or prevent the spread would be just limiting the number of sexual partners. That alone should decrease the chances of you contracting HPV. But like I said, HPV is very common, so it's very easily contracted when engaging in sexual activity. So although there's no treatment for the virus itself to remove it or to eradicate it from the body, its symptoms and complications can be controlled or managed. So for example, the genital warts, usually through your primary care doctor, she or she can provide medication to reduce the warts, the number of warts, the size of the warts. And if medications are not effective, you can then have them surgically removed. In addition to removal of the warts and managing and treating warts, cervical precancer screening and treatment is also recommended for those that test positive for HPV, which means that regular pap smears, regular HPV DNA testing to ensure that no cancers are being formed or developed, or if that's the case, treatment is prompt and they can help remove the cancer. All the symptoms of HPV is manageable to treatment and medication from your primary care doctor. So the best thing to do is get screened, make sure you follow the rules, use condoms or abstain, in addition to limiting the amount of sexual partners. And if you are positive, check with your doctor and follow the proper protocols to prevent any complications such as cancers. So pre-cancer screening and pre-cancer treatment can help and prevent serious complications in the future. Thank you so much for listening. These are my references.